So if when your resident is on isolation, there's a few things that are in place. There'll be signs on the door, there'll be a stop sign, and that alerts residents, family members to go talk to the nurses and see what they need to do. They will almost always be on what's called contact precautions. That means you wear gowns and gloves every time you go in the room. If their infection is in their lungs and they're coughing, like if they have MRSA in their lungs and they're coughing, they will also be on droplet isolation, and there'll be a sign for that, and you'll wear a mask with a shield in addition to your gowns and gloves when you go in the room. Outside of the room will be a cart that looks kind of like your nurse's med cart, but it's a little smaller, and in there you'll have your gowns, your gloves, any supplies you might need, the signs that go on the door, and it stays outside the door because we don't want to take, if we move somebody to an isolation room, we don't want to take a whole bunch of stuff in the room with them, because when they come off isolation, if it can't be wiped down and cleaned, it has to go in the trash. So you'll also have in the room a blood pressure cuff, a thermometer, a digital disposable thermometer, and a stethoscope so that you can take vital signs in there. You don't want to carry the pole, the vital sign pole, in the room because before you take it out, it has to be totally wiped down. So we keep all those supplies in the room. There'll be, if they're in an isolation room by themselves, there'll be 2 metal bins in there to put linen and trash. If they're in a room with somebody else on isolation, we may not have room in the bathroom to have those bins, so you might just have a regular trash can that you have to take things out as you come out from isolation. If they needed the lift for some reason, if they were a large resident, we have to take the lift in there. You would lay a sheet in the pad, over the pad, to keep them from being directly on the pad, and you would have to wipe it all down before you take it out of the room. We try to limit what goes in there so that we don't have to wipe everything down. Now, when they're on isolation in the hospital, they stay in their room basically, people come visit them, so being on isolation doesn't really affect their quality of their life. But the Centers for Disease Control recognizes that residents in a nursing home, they have a social life. They're used to coming out of their room. So when they're on isolation, it's really a very difficult socially, just psychological for them. So we do everything we can to isolate the infection, not the person. So for instance, if you had somebody who was alert and oriented and they weren't somebody that was going to pick their dressing off, and they had a wound, maybe a skin tear that got infected, we cultured it and comes back MRSA, we can put them on isolation, signs on the door and everything. In the morning when they're getting ready to get up, they'll get a bed bath, because if you're on isolation, you get a bed bath every day until you come off isolation. They get a good bed bath, make sure you clean under their nails really well, get them dressed in clean clothes, have the nurse come put a dressing on it which will be wrapped in cling and it will be secure, and then they can come out of their room because their infection is contained. We've isolated the infection but not the person. You want to, if that's the case, you want to make their bed every day, not just on shower days, because that way you can be sure that their linens are all clean and they can come in and go as they please. Now if they were to pull their dressing off, then they need to stay in their room. Over in the specialty care unit, I always tell everybody we do the best we can, because they're confused. You may tell them to stay in their room, but 5 minutes later they're out in the hallway. So you do the best you can to contain it. If somebody has C. diff, we do not let them out of the room. It's just not even an option to come out of the room if we cannot contain it. They're going to have uncontrollable diarrhea. They can't come out of the room. If they're coughing and it's in their lungs, they can't come out of the room. Each case is looked at individually by the infection prevention nurse, and that information will be shared nurse to nurse report. It'll be shared in your huddle. If you ever have any questions about what's going on with the isolation, let somebody know. In terms of coming off isolation, that will be directed by the infection prevention nurse. And that kind of brings me around to talk about coming to work sick. If you have a fever greater than 101, if you're vomiting, if you have diarrhea, you need to call and let the infection prevention nurse know that you are sick. We do not want you coming to work when you have those symptoms going on. So if that's the case, you need to call and speak to her. You'll be talking to her on a daily basis to find out when it's okay for you to come back. You have to be 24 hours with no fever, without taking Tylenol or anything to keep it down, without vomiting or diarrhea, and you're, again, not taking anything like Lamodal or Phenergan to stop it, and you're able to take solid food and have normal, bowel movements. So we need you to adhere to those. Now that doesn't mean if you want to go out on Friday night, you just call in and say you have diarrhea, because there's a good chance that we may ask you to provide us a sample. So please don't use that as just an excuse to call in. You know, when you're sick, you're sick. We understand that. We don't want you to come to work and get the residents sick, but just please be sure that you are, you know, coming to work when you are okay, but if you're sick, that you stay home. I think that's all that I have today. If there's any questions, you know, see your IP, and welcome to Coastal Manor, and thank you for keeping our residents safe and healthy.